Hello and welcome to Inside Edition to discuss national, regional and international issues in depth. At any point of the day, there is a sick, dying patient that the emergency department staff is fighting to keep alive. Emergency physicians see the very sick and injured patients and have direct impact on their lives. The doctors and nurses in this field of work, they work as a team under intense pressure against the unpredictable and always attempt to come out on top. Bahrain Emergency Medicine Conference is the first ever conference to be hosted at a large scale in the Kingdom of Bahrain. The emergency conference has been extensively organized to grasp the very fast growth and advancement in emergency medicine, primarily in the areas of pre-hospital, trauma, cardiovascular emergencies, pediatric emergency, critical care emergency, research, emergency nursing, and other areas related to the field of emergency medicine. BEMC 19 is an ideal platform to share knowledge, exchange expertise, and network and strengthen collaboration amongst experts and providers coming from all over the world. To talk about this issue more, we are joined by Dr. Ghada AlQassim, Consultant Pediatric Emergency, and later we will be joined by Dr. S.V. Mahadevan, Professor of Emergency Medicine at the Stanford University Medical Center.
Emergency teams are the frontline heroes of the whole medicine because the whole society knows that when they are in need of someone to help them, we are there at every hour of the day, at any time, and during their crisis.
We deal with all sorts of emergencies. Patients come to us unscheduled. They come with various injuries. They come with no clear history.
The life of emergency physician is full of challenges. The variety of cases such as traumas, heart attacks, overdosed, or even the non-emergent cough and colds.
Emergency schedule is difficult, demanding, and needs lots of commitment. But we never complain of getting up any time of the day, any day of the week, and coming to work.
To an outsider, the emergency department might appear chaotic, but to the emergency physician, it is an orchestral teamwork. We may jump from doing an ultrasound to putting a chest tube to inserting a central line, or even suturing, from managing a choking child to a seizing adult, or maybe helping a woman in delivery. So can you tell me, who else can do that?
20 years back, emergency medicine was still not recognized in the Kingdom of Bahrain as a specialty. Emergency departments were run by general practitioners who used to deliver a very basic care. Now, emergency departments in the Kingdom are run by board certified in emergency medicine who got their training and their respect.
Emergency medicine is a blooming subspecialty. We have fellowships and training programs such as pre-hospital, trauma, pediatrics, ultrasound, and many others. I chose pediatric emergency, and I love everything about it. Emergency pediatric physicians understand that children are not small adults. Their bodies work differently. The best person to take care of your sick critical child is a trained pediatric emergency physician.
Emergency medicine is a specialty of passion and pride. When we see a patient who's walking home, thanking the admitting specialty, not knowing that there were other people who are unknown soldiers who treated them in the very first hours of their arrest. Although they don't know us, but we are proud to be behind the scenes because at the end, we emergency family work for the patient, not for ourselves.
Emergency physicians save lives.
When seconds matter, emergency physicians make the difference.
Welcome back. Joining us in the studio is Dr. Ghada AlQassim. Thank you very much for being with us and answering some of our questions. Especially right now, the conference is taking place in Bahrain, and we've heard how much impact it has had already when it comes to all of the information, all of the topics that are being discussed. So what can you tell us about the conference, and what is the real aim that we're trying to achieve in holding it?
Thank you for having me. The first Bahrain Emergency Medicine Conference is a dream come true to me on a personal level, to every emergency medicine physician, and to Bahrain Medical Society. We have two main goals from having this conference. One goal is subjected to physicians and nurses and everyone who works at the medical field, and the other is related to the public. So what we hope in getting from this conference initially for the physicians, nurses, paramedics is knowledge, capabilities, expertise, elevating their standard to that international standard that we want everyone in emergency department to have. So which will reflect positively on patients. The other part is we want to increase awareness about when to come to the emergency department, because we do not see every case in emergency department. So we are hoping to increase awareness of the public is to use your GP, to use your health center, and as a first line. Then if you're too sick, then you come to me as an emergency physician or a department.
And the truth behind this really is that sometimes the emergency department is so overfilled with cases that are not truly emergencies that it takes from the time of the physicians that are actually facing or trying to deal with certain emergencies. Primary care centers have always played a very big role in the Bahraini society specifically. I mean, I know a lot of patients who are within the, who are diabetic or have a cardiovascular disease that now do have the awareness that, okay, if I feel something is wrong, I go to my primary health care and then I move on. A conference like this, how does it really create this awareness for the nurses and even for the patients later on, because the nurses are the ones that actually give it to the patients?
Sure. Something big that we're doing in this conference is reinforcing the meaning of triage. Now, in all emergency departments, we cannot see everyone who walks through the door. You know, we have to have a system that tells me as a doctor, this person is too sick, you need to see him now. This person is kind of okay, he can wait for an hour or another 2 hours, or this person is very okay, he can go and see his doctor, GP, health center. So this is what we want to train our nurses, this is what we want to train the paramedics to do, to be able to triage patients, to be able to reduce overcrowding in the emergency department. We have very close relationships, or health centers are, you know, our backbones. So we need them to take those less sick, less critical patients, so we can work for those who need our help.
And keeping that in mind, the physicians and the nurses at the primary healthcare centers have the same exact training as the ones in the hospital. So practically you're going to a smaller hospital. Well, there's a wide attendance from all over the world, either speakers or even participants. How can this further contribute to adding experience to develop our local medical practice?
The aim was to, as I said before, is to get emergency medicine to that international level, to get the standard of care. The guidelines that they're working with. So we wanted to unify the guidelines that we practice in all hospitals according to those international, well evidence-based guidelines. So the practice is up to that standard. So that was the aim of getting those speakers from outside.
And when you really look at the interaction that has already happened, or the speakers that have already been or given their speeches, do you see that there is some kind of, I mean, the people that are attending, do you see that people are interested, they want to have more information, maybe workshops that go into that?
Oh yes, the feedback from yesterday, from even the day before, we started with the workshops. People are eager to come to such conferences. People want to learn, you know, people who work in the emergency departments are really passionate about their work.
Yes,
so learning is a continuous process. So the feedback from those people was really positive. They wanted us, they were doing this next year, you know. So yes, definitely people want to learn. Even we had participants from across the bridge. We had some people from Kuwait, Oman, you know. Even some Americans who were working in the Kingdom of Saudi Arabia came as attendees to our conference. So that's something that's really positive for our conference.
Perfect. Well, the medical field, and I'd say even specifically the emergency medical field, always has constant technological advancements. Are these topics also talked about in the conference, how to make practicing medicine or emergency medicine easier?
Yes, definitely. The first day was workshops. We had hands-on on 5 different workshops, such as airway, such as ultrasound. Ultrasound is something big in the emergency department now. Everything is ultrasound rather than doing a CT scan, rather than doing, you know, so ultrasound. We also had a specific workshop for nursing. We had a specific workshop for paramedics. And it's all theory and hands-on. That had a great impact on whoever participated in those workshops.
Perfect. Well, we know that all of the workshops were fully booked for your event. This, of course, reflects the massive want of the people that are attending to learn more about these things. Tell us about the issues that were covered during the conference that you find particularly had to be covered in Bahrain for our medical practices.
Again, emergency physicians see everything. So there is no specific area that we cover. So the conference took that on board. We covered cardiovascular, we covered trauma, we covered pediatrics, we covered burns. So everything that we dealt with, we gave a flavor in that conference, especially that Bahrain emergency physicians are board certified, are trained now. So the speakers, even who are from Bahrain, who are trained, certified, were speakers at that conference, which also added a flavor to that conference.
Are certain cases that happened in Bahrain, are they also being used in the workshop as case studies in order to introduce certain things, or you foresee that for the future maybe?
Maybe for the next workshop, but something else that we did in this conference is, for example, research. Research is something big now coming up. So we presented posters and we gave presents for the winner poster. Research again, we did a topic about research. So, you know, we tried to cover everything that is new, everything that is on the floor now in emergency medicine.
Well, the emergency medicine in Bahrain is vast. There are the physicians, there are the nurses, and as you said, there are also the paramedics. And now we have the national ambulance system. What can you tell us about the advancement of the emergency practice in the Kingdom of Bahrain?
We work very closely with the National Ambulance because they are the first people who go to the patients, whether it's a car accident, whether it is in a workplace, in the house. So that paramedic needs to tell me before coming to me how sick is the patient he's bringing to me. So I will be prepared. So we need to train, we speak the same language. Some of the very excellent paramedics can do some of the jobs that we do. You know, a well-trained paramedic can do some of the work or the duties that a physician can do, like giving medications to the patients, like putting a tube for a patient. You know what I mean? So we work closely with the National Ambulance, with the paramedics in emergency departments.
Well, when it comes to nowadays, there's a lot of change with immediate action when it comes to medications and so on because of the research factor. What can you tell us about these changes and how they're implemented within the emergency medicine field here in Bahrain?
Again, in emergency medicine, we try to follow standards and guidelines. we discuss, as in today, we were discussing procedure sedation.
Yeah.
It's something really new, you know, and how comfortable would emergency physicians use procedure sedation, because it helps your patient in not feeling pain, especially children, for example. You know, so we're trying to keep up to date with the newest medications, with the newest guidelines regarding what to use of medications in the emergency department.
Yes. And when we look at the emergency departments in Bahrain, I mean, we have one of the biggest ones in Salmania, where hundreds, if not thousands, of cases every year are seen that are peculiar. And as you mentioned, research is a big thing that's coming up. Is there like a plan for maybe next year's conference to pinpoint some of these issues that might repeat themselves?
Definitely, even from this conference, we're coming up with recommendations to improve the service. Again, emergency medicine is a system rather than a department. So we work closely together, either being in the 3 main hospitals in the kingdom, as in BDF, King Hamad and Salmania. You cannot work alone. So emergency physicians work together. So if you have to create a system that suits everyone, you know, so we all speak the same language. So
well, at this point, I really want to ask a question, or it's not a question, it's more I want to bring out awareness. What are the most cases, emergency cases, that we in Bahrain have?
I'll speak about children because I'm a pediatric emergency. Most cases that happen that are preventable, and this is another thing that we try to reinforce. Accidents, you know, house, the things that happen in the house, you know, burns, for example. Simple precautions parents can take to prevent things from happening, you know, wearing a helmet, seat belts in the cars, you know. So if we take those precautions, we prevent sick kids coming to the emergency department.
And that's an actual department by itself, preventative medicine, that spreads awareness and uses media. What do you see? Do you see that more awareness is needed in concentrating on, for instance, traffic accidents, on, for instance, these small accidents that happen to children or other people?
Yes, definitely we need awareness programs, you know, just try to explain to parents how to prevent things from happening. And we try to do this in our practice. For example, if we get a parent who gets a child, you know, an accident for a child, you try to sit and do some talking with that parent, spend some more time, but a national awareness program is needed just to take the subject further down the road, you know.
Dr. Ghada, one of the things that Bahrain has excelled in is training practitioners, whether medical practitioners from all sides, whether it's physicians, nurses, EMTs. Emergency medicine is also one of these fields. What can you tell us about trained emergency physicians?
Again, it's a blooming subspecialty. The residency program is 4 years, and we do now, you know, we see interns finishing their internship interested in emergency medicine. The good thing is now we have minimum of 5 or 7 trained emergency physicians who completed their board certified. So when you go to emergency departments, you are in safe hands. We in Bahrain now are qualified enough to have board certified running emergency departments. So I can assure everyone that when you go to an emergency department, you will be taking care of a qualified emergency physician, nurse, or even the paramedics before coming to the hospital.
That's really amazing, especially that in a country like Bahrain, there's a lot of focus on the medical field. We're trying to bloom more and more in it, and that by itself is really a vouch for the medical team that we have. Thank you so much for answering our questions, and hope we have more discussions like this in the future about your next conference.
Thank you for having me. Thank
inshallah. And thank you for joining us. We're going to go for a short break and come up with another discussion with one of the conference speakers, Dr. Mahadevan, but after this short break. Welcome back. We continue our discussion about Bahrain Emergency Medicine Conference with Professor of Emergency Medicine at the Stanford University Medical Center, Dr. S.V. Mahadevan. Thank you very much for being with us today.
Thank you for having me.
For answering some of our questions. You are a speaker. You're still going to speak, but talking about a conference like that and the importance of such conferences, how do you value the exchange of expertise, especially that, I mean, worlds apart, but still, it's medicine is medicine, isn't it?
I think these conferences, like the first conference, the first Emergency Medicine Conference in Bahrain, is very important for an exchange of ideas, the opportunity for different practitioners from different parts of the world to learn about the way they practice emergency medicine in their countries. And for me, first time in Bahrain, to see how the Bahraini physicians are practicing emergency medicine. I have to say, thus far, after 2 days, I'm very impressed with their knowledge and skills and the way they approach the field.
Well, when it comes to the exchange of expertise, we really, like in the medical field, we value that very much because people from different countries have different experiences, especially with the difference in the cultures of the countries themselves. People that do a lot of exercise versus those that don't, people with sedentary jobs and so on. So do you see that there is a huge difference when it comes to exchange of information when it comes to that?
In terms of the conference itself, what I've seen is that I actually have been very impressed with the level of knowledge of the physicians. And you know, when you come to conferences like this, there's a perception that we, coming from a different country, there's going to be a unidirectional flow of information that we're going to teach. But in fact, what we find is that we learn as much as we transmit. So we're teaching, but we're also learning from our physician colleagues from different countries like Bahrain.
Perfect. Well, can you tell us about your contribution during the conference?
Yes, I had the privilege of doing a short presentation about what is emergency medicine and how it's different from other specialties during the opening ceremony yesterday. Spoke a little bit about innovation in emergency medicine education and the work that we're doing at Stanford overseas and training paramedics. And today I'll be talking about video laryngoscopy, which is a unique way using sort of a camera-based system to do a procedure called endotracheal intubation.
Doctor, do you find that this move in technology, this, I mean, very fast move when it comes to technology really affects the way medicine is practiced nowadays? Yeah,
for sure. Our practice of emergency medicine is evolving quite rapidly, and there are introductions of new technologies, some that are very effective, some not so effective. A couple of them are the use of a camera system to do a difficult procedure like intubation, the use of ultrasound to be able to look inside someone without any radiation, to be able to do it at the bedside and gain more information. In fact, some people feel that it will replace the stethoscope. So all of these new advances and conferences like the one we're attending at BEMC allow us to exchange information about these new ways of doing diagnostics or therapeutics amongst each other, and what it leads to is better care for the patients.
Yes. Well, there was always, like, when we do see patients, whether in the emergency room or other places, the time-consuming part is the diagnostic part. Do you find that more research should be done within diagnostic equipment or things like that, or do you think we've actually hit a place where right now we can minimize the time where a patient goes through diagnostic procedures, some of them very painful, very invasive, but where it minimizes the time they are exposed to that?
I think there's always opportunity to do more in terms of diagnostics, to try and, exactly as you mentioned, reduce the amount of time someone has to wait to get information back, reduce the pain associated with procedures, and so I think we're continually evolving in that regard. And then with therapies too, some of the things that we used to do 20 years ago we don't do anymore as we learn more about novel therapies that are targeted to an individual specifically rather than a group of individuals.
Yeah. Well, time consumption is a problem in emergency rooms all over the world, and a lot of patients have this problem of the amount of time that they have to spend to be seen. But one issue is that a lot of patients do come to the emergency room with not tertiary kind of sickness that emergency department will see immediately. So how is awareness spread within that context?
Part of me says, you know, they're not physicians, they're not trained health professionals, so how would they know? So we accept everybody, and then we make that decision once they arrive in the emergency department, do an early evaluation and try to determine how sick they might be, and then let them know, whether they need to be seen right away or whether we're going to have them wait a little bit while we take care of the sickest patient. So, it's hard when you're a layperson to know where to go, and certainly we don't want somebody to delay coming to the hospital if they have something really serious.
Yeah, true. But with the involvement of technologies, and also the involvement of management of departments such as the emergency department, that's also one of the points that the conference is talking about, the management of the administrative aspects. Where do you see can there be some improvement?
I think there's opportunity for discourse about different ways of managing emergency departments and quality of care and improving the timeliness of care. And I think those are the kinds of things that we talk about. What am I doing in my hospital? What are you doing in your hospital? Learn from each other and try and implement those things in our own departments once the conference is over.
Yes, yes. Well, what did this event achieve from your point of view? How have you reached the desired goals to further develop emergency medical practice when you see it here in Bahrain and the way it's practiced?
I think, when we look back on this event years from now, I think this is going to be a landmark event. If we go back to the United States, for example, it was 50 years ago exactly that the first emergency medicine conference was held in the United States. 50 years later, the first emergency medicine conference is being held in Bahrain. And I think this is going to be sort of the beginning of a series of conferences every year where emergency medicine just grows and grows in the country. So I think this is a great landmark event for emergency medicine in Bahrain.
What would you like to see more of in next conferences, maybe?
I'd like to see more individuals from around the world coming and contributing. I'd like to see more attendees, although I was very impressed. We had 500 participants, which is a lot for an inaugural conference. And I'd love to come back next year and contribute at that time as well.
Definitely. I mean, I see from the papers that we've seen and from all of the information that we got, the workshops were totally filled up, no places anymore for people to go there. So workshops have been a very important part of this. How do you see the importance of workshops and training people in these new procedures?
Lectures are basically a unidirectional flow of information, but workshops are a chance to do things hands-on, learn about new skills, get guidance from an expert in the field. And so that's why I think they filled up, is they were so popular. There's an opportunity to get that kind of mentorship and guidance. And so I'm not surprised that they filled up. And maybe next year, we talked about what next year, maybe more workshops, maybe more room for more participants would be fantastic.
How about the aspect of research within emergency medicine? How important is that?
It's terribly important, and it's something that's still in its infancy, I would say, even across the world. We're learning more and more about emergency department research, and we're doing more, but I can tell you one thing that's really important that we didn't know maybe 50 years ago, which is the earlier you intervene in a patient's life, and that means in the pre-hospital setting with the ambulances and the emergency department, the better their outcome is going to be. And that means we need to do more in terms of research in emergency medicine, because we're at the front line of taking care of these patients, and we can really change their outcomes and for the better.
Does that also mean that we need more people specialized in the emergency medicine department, whether nurses or doctors or any kind of specialty when it comes to the healthcare sector? Absolutely, because every second counts when you're talking about emergency. So in addition to training more nurses and doctors in emergency medicine, I think every medical student that graduates from a university in Bahrain, from a medical school in Bahrain, should have emergency medicine training, because you never know when an emergency is going to strike, whether it's in the clinic, in an airplane, on a bus, in a public space. Exactly. And especially like when it comes to basic life support training that all of us get, it also should be made more aware that even people outside of the medical field should go into some kind of training that will help them basically deal with the emergency situations, because emergency medicine is extremely unpredictable. Yes. So how do you see to further awareness when it comes to emergency situations for the people that are not of medical practice? Sure. They play a critical role in saving a patient's life, whether it's calling for an ambulance or doing basic life support, cardiopulmonary resuscitation, chest compressions, while they're waiting for someone to come if the patient's
really sick. So they can be lifesavers as well as the paramedics and the emergency physicians at the hospital.
Okay. Well, Doctor, how do you value Bahrain's initiatives in hosting such a major conference, especially that this is the first one in sports medicine, but Bahrain has hosted many in other medical fields, and how important is it to host these on a regular basis?
I think it's very important for some of the reasons that we had discussed before, interfacing with experts from around the world, sharing your own experiences, learning and advancing emergency care in the country, and then inviting those Bahraini physicians to come to our conferences as well to share their experiences. I think this is the first, hopefully, of many emergency medicine conferences, and it will just get better from here.
Yeah, I mean, you come from the Stanford Medical Center, and I'm sure that you see, I asked this question to Dr. Ghada before, but what do you see as the main problem or the main cases that are being seen in the emergency department where more awareness has to be done in order to prevent those cases?
Yeah, she talked about pediatric cases and prevention, and I think that's really, an important part. We play an important role in not only caring for people when they're sick, but also importantly, teaching them how to prevent injury. So wearing helmets, wearing seatbelts, pool safety for kids so to prevent drownings, learning about the dangers of alcohol and cigarettes, I think, and now there's a vaping epidemic in the United States. So we don't realize it, but we play an important role when we see those patients and counseling them and trying to prevent them from getting injured in the future.
Yeah. Well, you mentioned a really important part, not just the vaping aspects, but all of these new packagings, like for instance pods and that kind of stuff, and where we see children that by mistake eat these things or the medications. Should there be more awareness when it even comes to the packaging of these things and the way they're kept safe within homes, because a lot of people seem to just not really be aware of how easily, especially children or people that are not aware, or even elderly with different sicknesses like dementia, can access these, and this could be a life-threatening situation that is just over in minutes if there is no emergency care. Yeah,
keeping medications in a place that's safe from children, keeping those kinds of chemicals like detergents, which can be very dangerous if ingested, away from children, I think is equally important to things like helmets and seatbelts. Absolutely, absolutely.
Yeah. So continuous awareness, especially like with the new technologies we have when it comes to Instagram, Snapchat. We see a lot of people that actually take the initiative, and even doctors. I mean, within Bahrain itself, we have a lot of doctors and nurses that do not officially, as per for instance the hospital policies, but they do take this initiative where they do these snaps or these Instagrams and spread awareness about different things. Do you think that is of value when it comes to such situations?
Certainly. Any way that you can get the message out to the public, whether it's through Instagram, social media, or going and visiting schools or parents and teaching them about these principles, I think it's really important.
Okay, perfect. Thank you so much, Dr. Mahadevan, for being with us today, Professor, and for answering our questions. And we also would like to thank you for watching, and see you next week in another episode of Inside Edition.